So the one thing that we look at as physical therapists to get the athlete ready for that starting day is to essentially look at the body really from the foot all the way up, and it starts at the bottom. So the type of foot that you have and the type of shoe that you have is another key factor in being able to successfully train without injury. So that's one of the things that we'll be looking at with our athletes, and specifically with Nate, the type of foot he has, whether or not he's in need of an over-the-counter product or maybe a custom orthotic, and certainly the type of foot that he has, a shoe that can match that. And then of course, up the kinetic chain, we're very concerned about the flexibility. Two key muscle groups that I think are really, really important for runners is to have appropriate flexibility in the calf. And we look at 10 degrees of range of motion or greater as normal, and anything under 10, the body compensates. And of course, when the body compensates with a lot of mileage and repetition, you can get the overuse injuries. Coming up the chain, we certainly are concerned about the hip flexors. Those muscles will often get tight when they're asked to do more because the glute muscles are restricted or not working as efficiently as they can. I know a lot of therapists and athletes understand glute strengthening, but I will take it a step further and look at why their glutes are strengthened. Very often it's because of pelvic and lumbar alignment, and you put the pelvis and lumbar joints in alignment, you can facilitate the muscle to work normally. So usually what I'll tell patients is that if a muscle is too long, represented by my thumbs, and these are the fibers, the muscle doesn't have as much surface area. This is ideal, that's a strong muscle. This is gonna be a weaker muscle, and if it's too short, it will be weak again. So in clinic, literally, one of our concerns is to create alignment so that the patient can maximize their glute strength, and then the goal then is to build that strength to match the functional demands of life. And in an athlete that's a runner, whatever their body weight is, when they walk, they have to control that body weight. When they run, they have to control 8 to 10 times their body weight. So these tightnesses, these weaknesses, these deficits become really, really important to make sure that with the repetition that they aren't there. Otherwise, you're having injury and struggle. So one of the things that we'll do with Nate is making sure that his body is perfectly aligned so that when he's out training, he's not compensating, creating any repetitive injuries, and allowing him to basically get his cardiovascular system at the level it needs to be able to run and train at the level that he needs to qualify for the Boston. After assessing Nate, some of the key findings, which actually don't surprise me, were his feet. He has flexible, flat feet. When I looked at how much of a angle he had off of a horizontal, he had to come down pretty far to be able to hit the ground. So we're going to make recommendations on a particular anti-pronating type of shoe. I'm a big fan of the Brooks Adrenalines, but of course I'm not paid by anybody. Essentially a really good anti-pronating shoe. And then I think that we're going to probably put him in a custom orthotic. I think he probably has them, so I might just validate what he has, but because his rear foot and forefoot are so much off of the horizontal, when I have his ankle in a neutral position, he has to drop too far to hit to the ground. So we're gonna try to get a custom product to help hold his foot up, not 100%, we usually post at about 70%, okay? Going up the chain then, his calf flexibility, it was pretty good, but certainly something that it can get tight really pretty fast when you train. So we're gonna certainly show him how to properly stretch both calf muscles. You have two calf muscles, gastroc and soleus. We might even, if he's having trouble in the past, we might even train his calf muscles in an eccentric fashion. And what I mean by that is training the muscle to do what it's going to do when it's running. So usually when you land and come forward, your calf has to slow your body down. So we can train it to actually strengthen while the muscle's lengthening, as opposed to training it while the muscle's shortening. They're both important, but usually eccentrically, that's where people get into trouble. Going up the kinetic chain, I tested his, it didn't show on camera, but I tested all of his strength in his lower extremities. They were all 5 out of 5. Where he had issues really came out in the glutes. And when I assessed his lower back, he had restrictions from left to right versus right to left. There's some other detailed things in there that are probably beyond bringing up, but that dysfunction or imbalance is basically what caused the weakness in his glutes. So for a guy that strong, his glutes went right down. I gave him 1 inch in hip flexion and he was immediately strong. So he's actually using his hip flexors as a strategy to stabilize himself on one leg. We saw that a little bit with the standing single leg balance. He flexed his hip and he leaned a little bit. And those are 2 signs of weaknesses in the glute, when you have to flex a little bit because that's the dominant muscle, and then the lean to the side is actually the glute being weak. So we're going to get him on a program of making sure that we get him lengthening out his psoas or hip flexor muscles. We're going to get him on an alignment program so that when he does work on glute strengthening, he's going to be working at 100% capacity. I can, within 5 minutes, rebalance his pelvis and recheck his glute strength, and it'll be 5 out of 5 strength. And you think, wow, that's great. Now he's 5 out of 5. Well, he's 5 out of 5 on the table, but he's not 5 out of 5 as far as functional strength. So we want to build his strength in his glutes, and his core is a part of that, to be able to match the functional demands of life, okay? If he is doing something beyond the ability of that glute to stabilize, he's going to go into compensation, he'll have alignment problems, and he'll become inhibitly weak in the glute again, and then we start that process all over. So it'll be very important as he ups his mileage and training, that we keep his body fully aligned and then progressively building his strength to match the functional demands of what his life is, which is running and landing on one leg, which is a pretty challenging thing to do. I want to make one other comment, that when the foot drops in and it's unsupported, you immediately put the glute muscle at a disadvantage. So we can actually make the glutes fire more efficiently simply by making sure the foot doesn't collapse in. Because again, that muscle becomes a long muscle and then it becomes a weak muscle. The other thing we saw in his hip rotation is he had lots of internal rotation and very limited external rotation. Well, that internal rotation coincides with the body collapsing down and creating pronation or a collapse at the foot. I think the reason that is, and I've seen this in a lot of patients, is the muscles that we call them the go-go muscles, and some of them are external rotators, external internal rotators, they just get tight. They overwork because the glute isn't doing anything, and that's why we see so much limitation there. So as we build his glute strength to match the functional demands of life, we're definitely going to want to have him stretch those, not only his hip flexors, but the external rotate, or get him into an external rotation stretch. And as he continues to get stronger, we're going to notice that he's not going to be tight there. He won't have a lot of tightness in either area, unless he's studying 10 hours a day for his board exam. So, And I'm just trying to think, I think we pretty much covered it. There might be a few things here and there that come up. Oh, we looked at the upper extremity as well. He had more restriction in his spine on the right than the left, which is classic for a right-handed person, reaching for the mouse, drawing. And what happens then is things tend to get stuck. You get ribs that tend to kind of get twisted, which lock up the vertebrae. And when the vertebrae locks up, you have a hard time bringing your middle lower trap into a good position. And so when I tested him up in this position, he was weak on the right and very strong on the left. It goes back to what we were talking about in the glutes. When there's a length tension relationship problem, there's going to be inhibitory weakness. So the reason that maybe becomes important for a runner is if he doesn't have that ability to rotate well to the right and he's always rotating to the left, he'll be, as he's pumping his arms and trying to get greater stride, he might be limited on this right side, which is again going to affect what happens down into his pelvis. And this is the area that needs to stay open because he's, I think, about 6'4", so if he can stay balanced and open, he's just needing to really work on his cardiovascular fitness to be able to take his current 8-minute 30-second mile down to 6:30. And as you said before, he's capable of doing that for a half a marathon. He just has to then train a little bit more cardiovascularly to be able to get that to a full marathon and then qualify for Boston. So you heard me talk about the ways that we're going to hopefully prevent injury, but certainly one of the things that is maybe a little bit beyond at least today's conversation is kind of the training regimes and looking at nutrition and hydration and mileage and of course rest time. I think all of that is, depending on who you read, is I don't want to say debatable, but it's got to be designed for the person and what they're comfortable with. And I'm a big believer in progression, and I also think that taking rest is appropriate as well. You're not beating your body down over and over and over again. Let your body recover, hydrate, feed it the proper nutrition that it needs, which gives you the ability to go back and train harder cardiovascularly, which is ultimately what's going to bring your times down. So it's obviously a separate conversation, but also equally important, I think. So we have a general idea of what Nate's challenges are, and I'm sure through the process he's going to have some aches and pains along the way. Dry needling is a great modality for trigger points that can be pain generators. Usually the trigger points actually develop because a muscle is overworking. That can happen in training, or if a muscle is compensating for something that's tight or weak, above, below, and adjacent. It's another reason why the dry needling can come into play. As far as anti-inflammatory sort of things that we offer, I mean, we have a Class 4 medical laser, a $35,000 piece of equipment that is amazing for reducing pain, inflammation, and helps with tissue healing. I mentioned the dry needling. We have our staff doing the Graston technique, which is another way of just mobilizing soft tissues and helping healing and bringing blood flow to the area. Of course, our hands are a big modality of manipulating tissues, joints, muscles, fascia. Of course, you heard me talk about orthotics and foot gear, making recommendations with that. We have ultrasound, iontophoresis, just modalities to help with inflammatory processes that may be an issue in a specific area. Hopefully we're not going to see any plantar fasciitis or specific itises, whether they be muscle or tendon, tendon or ligamentous itises. And of course, there's always heat and cold. That's also can be a good modality. There are all sorts of superficial analgesic rubs that may not be super therapeutic, but they might help with just plain general muscle soreness. I'm trying to think if there's anything else off the top of my head. In general, I would say probably just the knowledge in the hands of a therapist are the biggest modality you can have. It's one thing just looking in a book and saying these are the sort of things that are good to do if you want to be a good runner, but having that ability to tailor the individual's problems and body type is really, I think, pretty key to being able to have a successful training regime to get you to that starting line and ultimately the finish line.